Texans will soon take new steps toward returning to normal amid the pandemic. Governor Greg Abbott is giving some Texas workplaces more freedom to reopen and serve more people. Wes Rappaport looks closer at these relaxed restrictions and the key metric on which the governor is basing his decision.
Governor Greg Abbott gives the green light for retail, restaurants, office buildings, manufacturing, museums and libraries, and gyms to expand from 50% to 75% capacity starting Monday. This applies to areas where COVID-19 patients make up less than 15% of people in hospitals.
When COVID hospitalizations are high, it means that the spread of COVID is excessive.
Abbott says 3 regions, the Rio Grande Valley, Laredo, and Victoria, don't meet the hospitalization threshold to reopen further. That's a key metric in guiding the governor's decisions.
Hospitalizations is the most important information about the severity of COVID in any particular region. It is also the most accurate information available on a daily basis.
In Abbott's announcement expanding options for most Texas businesses statewide, the governor notably left one cornerstone of the Texas entertainment industry out: bars.
We need to work with the bars on effective strategies that will ensure that when they do open, the possibility of spread of COVID is contained.
Bars that properly recategorize themselves with the state as restaurants can open their doors, but state leaders recognize there is still more work to be done.
We should learn a lot from this. The thing that the summer taught us was the risk, the danger, the devastation, the destruction, the loss of life that COVID-19 can cause. I lost a very close personal friend.
The virus is still out there, and we still have to be smart about what we're doing.
I'm Wes Rappaport for State of Texas.
We wanted to take a closer look at the change in hospitalization numbers. State data presented this week showed that at the peak, people with COVID-19 made up almost a quarter of patients in Austin hospitals. Now they account for less than 4%. Health Authority Dr. Mark Escott said part of the decline is because most people infected now are younger and healthier. For a deeper dive into the governor's reopening announcement, we go to our reporter panel. Nicole Cobbler covers politics for the Austin American-Statesman, and Wes Rappaport is our State Bureau reporter. Welcome to both of you.
Thanks.
Thank you.
Sure. So Nicole, let's start with you. The governor now says hospitalizations are the most important number when it comes to reopening. How different is that from when he was doing something else before? What are some of the reasons he's making this change now?
Yeah, that was really a shift from his previous, decisions to reopen. I think what he used to focus on a lot was the positivity rate. He actually made no mention of that yesterday. And he also focused a lot on new cases. He also didn't really talk about that, but he did say yesterday that he would be looking at all the sort of important measures, but really would focus on hospitalizations. It's not really clear why that shift happened.
Mm-hmm. Wes, the governor has some critics who say he's changing the standards and moving too fast. How's this playing politically?
Well, you do have the concern there that at least from some that we've heard from, that say, this is moving the goalposts, right? We're looking at the positivity rate. Okay, we're not looking at that anymore. Election day is about 6 weeks away here. And so there are some concerns, especially among Democrats, that some of the decisions are being made with a political perspective, with a political angle. Certainly, I'm not the person to make that judgment, but we know from the far right that there are calls to just reopen everything, and so he's faced criticism there. We know from the far left that there are concerns about how the advice from the doctors and how he's analyzing the data and how that's being used.
Nicole, the big omission from the governor was the reopening of bars. A lot of people have pressured the governor to move forward on that front. What did he say about leaving them out, and what's been the reaction so far?
Yeah, I was kind of on the edge of my seat yesterday to see if he would reopen bars, because you're right, that business groups and members of his own party have really pressured him to do that. He mentioned it. He said, we're not going to reopen bars at this time just because he still feels like these are areas that would spread COVID. And he did say that they're working on ways to figure out a way to safely reopen these businesses. But it's going to take some time.
We've seen officials like NIMKID, Dr. Hellerstedt, Dr. Zerwas, they've been with the governor for most of the press conferences. Who are some of the folks behind the scenes that the governor's working to make these decisions, and especially in light of kind of this shift in things?
Yeah, he does have, task forces for reopening and for infectious diseases. It's definitely all the people that we see that he's working with regularly. Another person that I talk to a lot is Dr. Mark McClellan, who is on that task force I mentioned for reopening. He's one of several doctors that the governor, from what I understand, is regularly in contact with about the best and safest ways to reopen.
So Wes, we've covered bars and the numbers change. Any other surprises from the governor's announcement?
Well, I think that if you just take a step back and look at the big picture overall, we've heard from other members of the legislature, the lieutenant governor, the speaker of the House, that this is a step towards freedom, and that this was because Texans worked together. Some have said, yes, there is a lot of unity on this, and that people have followed those best practices, the hand washing, the mask wearing, and the social distancing. I think there's a lot of people that disagree on the approach, whether that's broken down by party, by region, urban, rural, I don't know, but we have definitely heard from groups of people around the state with very differing opinions. And so I think that will be something just to keep in mind that as we move forward here.
All right, Nicole, Wes, thank you for being with us.
Thanks.
Thank you.
Some critics of the governor are taking data on COVID-19 deaths out of context.
It's not interpreted as this being a positive.
A statistic from the CDC being misinterpreted, how that's pushing some people to pressure the governor to move faster to reopen Texas.